Hi everyone, and welcome to the Student Nurses Association second meeting. My name is Erica and I'm the president, and we just have a couple of things to talk to you about to get you informed, and then we're going to have a speaker who's going to talk for a little bit after that. So up first is...
my name is Ben. I'm the vice president. Sorry, are you going for someone else?
Yeah, no, that's fine. We can just go through that.
Okay. I just got a couple points real quick. As you can see, we have SNA t-shirts right now. Those are $15 a piece, and we also have the hoodies, which are $35. And so that all goes back to SNA, so we can do more activities and have things for you guys. We're planning on doing something probably during finals week that'll have like maybe some food or something to I don't know, just relax everyone during finals. The other thing I wanted to mention, we have trivia night, which is not this semester, but it's coming up next semester, and that's going to go towards St. Louis Pride as what we're going to be raising money for. And that's an organization that we actually raise a bunch of items for over the summer, and they have to do with like low-income mothers who are cancer patients as well.
No. It's just low-income mothers and adolescents, providing healthy meals. They do baby showers for them, things like that. They provide them a safe place, like babysitting. They have volunteers that will babysit for the moms who go out and work. Daycare, and then just different resources. They provide resources for them to make sure that their children are getting fed, and if they're pregnant, they're getting adequate nutrition and stuff like that. And then getting all the supplies they need, like diapers and bottles and things like that. So it's a good organization.
Yeah, really good. So just look out for that. That'll be next semester sometime. Still figuring out the details for that.
So we just finished our canned food, or our food drive for the food outreach, and we got a lot of cans for that. I'm not sure. We didn't count how many, but we did really good. It filled my entire trunk, so it was really great. And then we're going to have Lydia's House, which is going to be another donation drive, and they take like diapers, any kind of baby items, bottles, formula, anything you can think of for new mothers. So we're going to have that drive all of November. We're going to start that now, so you can just drop everything off in front of the SNA door. And then we're also, UMSL's doing an UMSL-wide canned food drive, and that's going to be at the end of November, beginning of December time frame. And then that's also going to be dropping off right by the SNA door. And that's just regular cans.
That one too, we did win last year, so no pressure, but we were the biggest organization to win, like North and South Campus. So if we could do that again, that would be really awesome. So I think we should try to keep that up for the UMSL drive.
Yeah, but that's, so that'll be our last canned food drive of the semester. So if you haven't done any donation drives, we have these two coming up, so you can still fulfill your two donation drives with these next two. So that's it with that, though. And I'm Allie, I'm the volunteer coordinator. So if you have any questions about volunteer stuff, it's kind of coming to Lydia is the fundraiser coordinator, and everything's going to her and I. So if you have questions, you can ask me about volunteer stuff. But that's pretty much it. That's all I have.
And for volunteer stuff, make sure you guys are checking OrgSync, because we post different volunteer opportunities all the time that are going on. And there's always somewhere to volunteer and things to do. And if you guys want to volunteer in your own time, anything, any event or anything, you guys are more than welcome to. But we do post ideas on OrgSync all the time. So just be checking for that.
And there is... I made a PowerPoint of different volunteer places and contact information. That's on OrgSync. And there's also, I got all the contact info for different hospitals if you want to shadow, because you can shadow and that'll be volunteer hours as well. So check that out if you want to find the HR person or the person to contact if you want to do shadowing. There's Children's Hospital, St. Luke's, Barnes, like all of them. So feel free to do that. And also, we went to the Missouri Student Nurse Association conference, and I have some information over on this table over there. There's, I I got a bunch of brochures. You can't take it home, but you can look at it, and if you have questions, let me know, and I can get you contact info for some of that stuff. There's like mission work information, and then different programs for after school, like CRNA programs, graduate programs, and also the like Kaplan information, and then I'm trying to think what else I got. And internships as well. There's the Mayo Clinic is having actually an externship for the summer. So if you guys are thinking about externships for the summer, they're going to start applications in January for most places. So that would be something to think about. Start thinking about.
The only thing I think I could say on the volunteering and shadowing is that we do ask that it has something to do with healthcare in that aspect of it, and we do ask that you cannot be getting paid for it. It can't be part of your job, and it can't be for school credit as well. We can't have you kind of double dip like that. So it is something that has to be on your good time for the community. It has something to do with healthcare. Other than that, really, it's fair game for whatever you want to volunteer or shadow for. And if you guys have any questions, or want clarification on if something would count or if something's okay, you guys can always ask us. You want me to keep on going?
Yes.
Okay. I'll keep on going my part. I'm Tara. I'm the treasurer again. Go over my really fun money stuff if Dan can just pull up the checkbook. Like I said last time, this is all public information now this year. Anyone can pull up on WorkSync to see how much money we have and how we're spending it. Yeah, I think it's that one. No, I lied. It was the other one. I'm sorry. Yep, there it is. So, like I said, this is all public information on everything that we're doing. We do have $500-ish to deposit in there from our t-shirts and everything. So we do have some of that money finally coming back in, and that is what's going to help offset everything. And this is to last us until the SABC funds come back around next year too. So, but everything looks looking good. This is why we do the fundraising and everything though too, so you guys can see how we're doing our money and then what we're doing with it, with you guys contributing all your money and everything. The only couple things that I have working on right now is I'm going to try to do something a little bit special for our graduating seniors. Every semester we've got our nurses that are all graduating. I'd like to start the idea of doing cords when you guys graduate, and with the College of Nursing, you guys graduate with black cap and gowns and an apricot tassel, and I'm playing with the idea of getting a little apricot cord, and that way our SNA members can stand out a little bit more. So if you guys want your recognition for your SNA participation and all your hard work, that's what I'm interested in coming around with the idea of. The only thing is that I need to know how many of you guys are interested in that. So if you guys are graduating in December and you're interested in that, you can see me after this, or you can shoot us an email to let me know if this is something that you want me to look forward into, and things like that, or if you guys have other ideas of how we can kind of help give back to the community and give back to you guys. But that's what I'm thinking about right now is cords for you guys to get your special recognition for all your hard work. And then the only other thing that I had to add is that we do go to the student government meetings on North Campus so that we can stay involved with things going on with the campus. You know, we learned about the canned food drive that's coming up. And the only other thing that I have to add is that there is a class coming up. It's not really a class, it's more like an opportunity to talk to somebody about all the Title IX stuff that's going on right now. You guys know this is big in the news. It's in a lot. Actually nationwide, they're really working with campuses a lot against sexual harassment and sexual assaults and violence on campuses overall. So this is something that even the president is really working hard into, and he's actually working closely with UMSL too to set this up. So UMSL has set up a consult to come in and answer anybody's questions, faculty, students, everybody who has any questions or wants more information about it. That's going on Wednesday at 1 p.m. on North Campus in the SGA chambers. If anyone has any other questions about that or Title IX information, then let me know. But then, like I said, it's big. It's in the news right now. So if anybody wants to know more information about that, that's going on Wednesday, or you can ask me about that too. That's all I've got.
Great. I'm next. I'm Dan. I think I may know most of you, or chit-chat with you all a bit. I'm the marketing director, so it's my job to get people interested in SNA. And I created a Facebook group. Some of you all may have been invited to it, whether you wanted to or not. I'm still trying to figure out how that works. I think I need to be friends with you in order to invite you to a group. This is a secret closed group. Shh, don't tell anybody. Actually, do tell people, but I also just did get the password and username from the old SNA Facebook page, which I think no one is really friends with because it's that old. So I'm going to be working in the next 2 weeks to get more people involved in that, because I know how logging into OrgSync sucks, and that it's easier to check your phone because your Facebook's on there already. So I'm doing that. If you are having problems with OrgSync, let me know. If you don't ever check OrgSync and you have questions about how to do something or turn something in, you can post it on Facebook and we can get you an answer real quick. It's probably the fastest way to get in contact with all of us at the same time is to post something onto the Facebook page so that we can all see it. And plus other members can see it too, and they may be able to answer your question. And then I sent out an email today saying that we got some funding from the bookstore to have a drawing, which I'm now ripping a piece of paper for, and someone already did that.
I did not.
Okay, I just need something to pull a number out of, corresponding to the number you sign in with, and you can win $50 to the bookstore. So, do we have a bag or a hat or a lunch pail? Yeah. I think,
Erica's main fan might be the winner because
okay.
Do you want? I'll put it in your hands and I'll pick it up.
Okay, sounds good.
Do you want to go over the points while we're doing
So, 15. Gina.
No.
All right. Gina and
3.
Marissa.
Nice. Hey.
So you can get like half off or a third off of one of your books.
Thank you.
I don't know when it expires, but I just got them today, so maybe a year.
You're so great.
And I guess just to recap for anyone watching online, that we're going to do the same thing that we did this time, that it's going to be open for the rest of this month. You guys got to just email us with the code word, which is going to be
Birthday.
birthday.
Code word is birthday.
So just like you did last time, email to sna@umsol.edu, say the code word birthday, and then you'll get your participation for this. But as you can see, it counts to be here too, because you get some cool gift cards and a lot of pizza. Which reminder, there is still a ton of pizza out here. So
Literally, you guys can probably all take a whole pizza. Not kidding. And real quick before we, I guess, adjourn.
Just have a couple more.
Or no, I'm sorry,
Yeah.
I just got a couple more things. Go for it.
Do you, okay. I was just going to give you guys an update on a couple of things that we're working on. For next meeting, we're going to have someone from hospice, home health care, just come and talk and give a little bit more information on hospice care and that type of nursing and the opportunities involved for nursing students and volunteer opportunities and post-graduation in the nursing field for hospice care. I also got in contact with a recruiter from Mercy, and she recruits all the nurses for Mercy's team. So we're working on setting up a presentation with that recruiter and a couple more people to give some information on what they look for in prospective employer, like when they're going to hire, the kind of things that they look for and what she's interested in the recruiter position for that. And lastly, we are going to be hosting a blood drive. We got the okay from Student Life to be doing that. But the 2 dates that we came up with were already booked with Mississippi Valley. So we're still working on a date for this semester. We're for sure having one next semester, and hopefully we can get a date worked out with the blood drive and that can work with all of us to host a blood drive this semester also, so then we can have 2. And lastly, we have a guest speaker today. If you guys want to come up and introduce yourselves.
No, just be quiet.
Just you?
Yeah.
Okay.
She's not allowed to talk.
No?
Just kidding. All right.
Sorry, I'm moving everything.
You don't know my name? I don't know if I know my name. What is
Come here. Yes, I did. Yeah. He's your
Jason Barber.
Okay, well, you can take this.
I can take the reins. How's everybody doing? Cool. I just recently learned that why iPhones are cooler than Androids. Who has an iPhone? So we're so grateful to the iPhone technology of pin dropping is how we found ourselves here. So my colleague Holly, she had an iPhone and I didn't. If she didn't have an iPhone, I probably wouldn't have found my way here. So iPhone, Apple rocks. Android sucks. All right. Yes, if you can go to a website or show a video. I want to show a short video. How many here either know or currently work as a medical scribe? Scribe.
Oh, scribe, I'm sorry.
Yeah. No. Does anybody know or apparently nobody here is a medical scribe. Does anybody know a medical scribe?
I've worked with them. I mean, not with them, but, you know, around them.
What do you think?
Well, they follow the doctors around everywhere and take notes. Yeah.
Who likes to type? I don't know if I'm going to recruit anybody. That'd be a tough deal. All right, so links.imscribe. She's being my scribe right now. .com /scribe job. That's getting ready. Okay. Yeah, I'm going to show this short video clip. This is just kind of a day in the life of what it means to be a medical scribe. This is one of our training managers, the young man in the gray scrubs. His name's Paul. He's a pretty cool guy. And then one of our partner physicians for headquartered in Fort Worth, Texas. And this does like 10 times better of a job than I am trying to explain it. So.
Hello everyone, and welcome to the Mont Emergency Department, home of I Am Scribe University. My name is Spencer Head, and I'm a Scribe U coordinator here at Physicist. I teach the charting fundamentals to incoming trainees that show up here to I Am Scribe University. Now, what you're about to see is a dramatization of what it's really like to be a scribe alongside a physician in the ED. In this first portion, Paul will update his physician on a patient that's suffering with chest pain.
Hello, Dr. Taylor. My name is Paul Hickey. I'll be your scribe today. We have one patient to be seen immediately in trauma bed 1. Okay. The patient presents with crushing chest pain via EMS, onset 20 minutes ago. Okay. The patient has a history of an MRI in 2009 treated with cabbage. Okay. I pulled up an EKG from a visit 6 months ago. Okay. The patient presented with chest pain then. All right. And here's the EKG done tonight. Okay. So the EKG shows a sinus tachycardia with a rate of 128. No ST elevations. There's an old inferior infarct. Let's go see the patient. Okay.
Now that you've seen what it's like to interact with the physician, you're about to see what a typical patient encounter will be like on somebody that's suffering ear pain.
Hello, I'm Dr. Taylor. This is my scribe Paul that we'll be documenting for me today. What brings you to the ER today?
My left ear hurts really bad.
And when did that start?
I want to say 4 days ago. It started as a small earache, but it's been getting progressively worse. It feels like there's a pressure in my ear.
Okay. Have you had any fever, chills, cough, runny nose, sore throat, anything like that?
No, none of that, just the earache.
Okay. Have you had any change in your hearing, any drainage from your ears or ringing in your ears?
I have had a slight decrease in hearing, but no ringing, and I have had some drainage come out of my ear.
Okay. Do you have a history of ear infections?
Yes, I had a lot as a child during the summer months when I would swim in the pool.
Okay. Have you been swimming recently?
Actually, yes. I've been at the YMCA swimming labs trying to get back into shape.
Okay. Have you taken anything for the pain?
I took some Tylenol, but it only helped for a short period of time.
Okay. Well, I'm concerned we may be dealing with an ear infection here. I'm going to examine both of your ears. I'm going to start with the good one first. And that ear is normal, like we expected. Now we're going to examine one that's been giving you problems. Okay. Can you open your mouth and say Okay. So your pharynx looks normal. The left ear canal looks red and swollen. I'm concerned that this may be an ear infection that we call Swimmer's ear. So I will prescribe you some antibiotic drops that's going to treat the infection. If your symptoms get worse, you'll need to come back and see us here in the ER or follow up with your doctor. Otherwise, you can just follow up with your doctor as needed.
Well, I hope you enjoyed that video, and our hope here at Physicist is that video showed you what it's like to be a scribe in the ED and to follow a physician. I hope to see you here in the future as you begin your journey as a scribe.
Yeah, so we got our start here in St. Louis about 4 years ago. We started our program at DePaul, SSM DePaul Medical Center, right? SSM. And we have grown rapidly over the last 4 years. The biggest, I guess, cause being, which I assume everybody here wants to be a nurse. I'm at the right student nurses, so yeah, you should have the right meeting. I guess the biggest driver for somebody like yourself to get to the medical field is to improve patient care. Is that fair? Everybody here care about patients, and most of the students I've worked with over the last 4 years, their main goal is to help patients and to make an impact in a patient's life. What we have found is there is a increasing demand to increase the quality of patient care, and especially in the emergency department. 95% of our scribes that work with physicists work in the emergency department. So one of the greatest challenges in emergency medicine is the efficiency and delivery of care due to the nature of the medical records system. How many have worked with electronic medical records? How many of you have had challenges first learning the electronic medical records? It'd be kind of cool if they work like Facebook, but they don't. Facebook's more of an intuitive software platform that it just works differently when you're dealing with medical records. I mean, it's a lot of protected information for a patient, and so it's very challenging. And you don't have cool software people working on it. You have more. You have people that are that don't think that way. So one of the challenges that we're facing in the medical community is these electronic medical records. They don't always talk to each other. So let's say if I'm a patient, I visit DePaul, I'm going to give my information to my provider there. That information is going to be documented. However, if I were to go to Christian Hospital, they're using a different electronic medical record system, and the communication may not always coincide or work together. So because of that, the challenges with electronic medical records, this is slowing physicians down. How many have experienced that personally? Physicians not being able to keep up with the workload and the demand, patient volumes coming into the emergency department. And so that's why we have medical scribes. And it's an unbelievable opportunity for you as a student who will one day be a healthcare provider yourself, a healthcare professional, which all of you are on that track. What do we have to offer you? Well, we have an unbelievable opportunity for you to truly and greatly impact a patient's experience at the emergency department. Our scribes are able to assist physicians so that when a physician is seeing a patient, they're focused on the patient, eyeball to eyeball, having a conversation with the patient. Their head is not buried in a laptop or a computer. How many have seen that before? Have gone and seen a physician and they're just I remember visiting a physician with my wife, and literally the physician did not make any eye contact whatsoever with my wife during the entire visit. I think it was his first day working with the EMR system. Matter of fact, he called in one of the administrative assistants to help him try to navigate through it. It was really, it was a really bad experience for my wife. A few months later, it sounds like my wife has to go to the doctor a lot. She does, but she happened to go see a physician again. And one of our scribes is really cool because I've been recruiting scribes for a long time, and I was like, we were in the ER, and I was like, wow. I saw our scribe there, and it was like really great to see how my wife's experience was just unbelievable because she was having a situation, and she felt very uncomfortable because she didn't know what was wrong with her, and the physician was able to put her mind at ease and was able to help her. And all the while, matter of fact, it was one of the scribes I recruited. He was there documenting all the information in real time. It was like, that's when I was really proud. And I was like, wow, this is a really phenomenal opportunity for the patient. I mean, this is really going to made a difference for my wife, and I saw firsthand. I've been recruiting scribes for a little over a year. I've never scribed myself. I was never smart enough to. I was going to go to medical school my first year in college, and then in like 3 months I decided to become a PE teacher. So kind of a little difficult. Something about I had to take chemistry, and chemistry didn't make a lot of sense to me. So I thought I could I love baseball, and I thought I could show somebody how to throw a baseball. So it was either chemistry, baseball, and chose baseball. But I do, as you guys can tell, I do like to talk. So I like to talk to people about their future and their future career goals. It's one of my passions. And so a few years back, I started with physicists, started recruiting pre-health professionals like yourself, and saw this opportunity, and it truly is a great way to gain experience. Now, I know that your end goal is to be either a nurse, BSN, right? BSN, you guys on the BSN? Yeah. Nurse. Anybody want to be a nurse practitioner? Awesome. You would love to have a scribe as a nurse practitioner, and this is a great way for you to gain some experience in the hospital setting. So, one of my former colleagues, she was over our training department for a while. She's a BSN, and I asked her, I would say about 30% of our scribes are pre-nursing or nursing students. We have a large volume. We have grown over the last couple of years with nursing students wanting to work in the scribe job. And I asked her, because obviously it's a no-brainer for pre-meds, right? For pre-meds, they want to be a doctor. They want to be around doctors, and they think it's cool. Makes sense. We have a lot of pre-physician assistant students as well. But I asked Melissa, I said, Melissa, what would be the big advantage for a nursing student or pre-nursing student? And she said, the opportunity to learn, and I don't know what this means, so this is just what she said, to learn the clinical, I kind of know what it means. I've been around medicine now for the past few years, so I kind of picked it up. But the clinical pathways to medical decision making. And so what you're going to learn, what you are learning in nursing school are those, hey, why, whatever stage the patient's in, whatever the medical decision making process is. How many of you are learning about that a little bit, the medical decision making process? The beautiful part about being a scribe is that you're going to be inundated with that. You're really going to be exposed to that. You're going to see, you kind of, as a nurse, you will. I think it's a great thing to have a physician as your ally, and you guys are working together for the overall good of the patient and their care. And this will give you exposure to that. In addition to that, apparently you guys have a nurse recruiter coming for Mercy. We scribe in the ER at Mercy. We have several scribes. What's really cool is you'll build relationships with the hospital administration, specifically in the emergency department. You'll develop a reputation. The medical community is very tight niche and very small, and so working as a scribe, you will. That's when your medical reputation will build. You'll become known in the emergency department. For both reasons. If you come, we've had scribes come and do a poor job. They didn't have a good work ethic, and they burnt some bridges with that hospital. They'll never get a job as a physician or a PA at that hospital because their reputation was tarnished with their poor work ethic. That doesn't happen very often. As a matter of fact, we don't have those instances very often. But likewise, we have several scribes that we hired that were in nursing school in Fort Worth, and they go on to get jobs in the ER, OR, critical care in the hospital because of the relationships that they made working in the emergency department. So, yeah. Any questions? Yes.
Is there like a training thing that you go to? Because what if you don't type fast enough?
No, we just put you in there. We just
No,
put you
really?
in there, hand you a computer, and hey. I'm just
Yeah.
No, that's a great question. Yeah, so training is very comprehensive. We have a training center here in St. Louis. Actually, it's in Maryland Heights. Maryland Heights. It's about 15 minutes from here, 15, 20 minutes from here. We have 3 stages of training. The first stage is Scribe University. It's a 3-day class that doesn't cost you anything. This is where we give you kind of the foundations of building a medical chart, learning how to complete a chart, and that begins with learning how to construct a history of present illness. We give you some tips on improving your typing. How many here, if you can type 40 words a minute, at least 40 words a minute? That's what we look for. If you can't type at least 40 words a minute, you probably would not be successful as a scribe. As long as I've been doing this, it's kind of like that's the magic number, 40 words a minute. And that's dictation, 40 words a minute. So usually that's a little bit more difficult than seeing a paragraph and typing that. You actually have to listen and type. But what I have found, and Holly, who is allowed to talk, by the way, she is our new recruiter here in St. Louis. She took we have a typing test. She took it, and it's very challenging, but you get better as you do it more. And so, same thing. Once you begin to train and work at it, you get better at typing. The 3-day class, once you pass that, we have a 96% pass rate. Once you pass that, you have to be selected, of course. You have to go through our recruiting process, be accepted to go to Scribe University. Then you would begin your trainer-led residency. This is where you have 6 to 8 training shifts on the floor, and that's truly when training starts. That's when it gets very challenging because now you're in the emergency department. You're hearing the sounds. People are telling you to get out of their way. Crazy. I mean, it depends on the ER. We're in 14 emergency departments within St. Louis, so they range in level of hysteria, I guess. We're at Mercy, which is pretty high end. We're also at Christian Hospital, which is pretty. It's a pretty big facility. All the way to Alton Memorial, which is very low key. It's pretty laid back. Your 6th, that's very tough. What I tell all of our new hires that you're gonna freak out and think, oh my goodness, what did I get into? Not just being a scribe, but even being in the medical field, because the emergency department really exposes you to the very real nature of critical care and trauma. You're going to see the most drastic. You'll see gunshot wounds. You'll see motor vehicle accidents. You'll see children who pass away, and that'll be very devastating. That'll be very hard. To people coming in who have a headache and want some medication, and it just ranges all over the place. But it's when your first 6 to 8 shifts, you experience that. You experience codes. I mean, it's really, really challenging. So there's nothing we can do from putting you in a school. Even you've been going to school here for how long? It doesn't matter. I mean, you could be brilliant. We have brilliant pre-medical students who have 3.8 GPAs, and they study medical literature, and they've done amazing research, and then I put them in the ER, and they freak out, and they're like, I don't know if I want to be a doctor anymore. I mean, truly, you have to have that environmental ability to adapt and see those things. Now, most people who are getting into the medical field for the right reasons absolutely love it. Absolutely love it. They love the thrill, they love the energy, they love the dynamic nature of it. And then once you get done with the 6 to 8 training shifts, then you begin your 300-hour residency. We have 300 hours of training for that reason, because it takes about 300 hours to get used to the job. Now, you're working by yourself after shift number 6 or number 8, depending on your comfort level. But you still need, our chief scribe and our trainers are still there to support you. We have a back office training team that's, auditing your charts, making sure that, you're completing everything you need to. Great question. Yes, sir.
What's the starting wage and other quarter benefits?
It's less than $100,000 a year. Starting wage is you make minimum wage through your residency training, and then you get a raise to $10 an hour afterwards. So now, one caveat: you're not going to make a lot of money doing this job. 88% of our scribes move on to a professional medical career, so med school, PA school, nursing, nurse practitioner, occupational therapy, physical therapy, gym teacher. There's only been a couple of those.
We do have probably most of our members watching online, so if they have any questions, can they just email us
so you have
and
like,
we'll pass it along to you?
So we're online right now?
Mm-hmm.
It's really cool. Oh, so this is recorded. Yeah, completely. So I'm going to write some things down. If they have questions. Hopefully my penmanship's good.
I don't think they actually see over there on the camera. They're only seeing like where you and Erica are.
If you have an email, though, we could.
Yeah, so email address is recruiting@iamscribe.com. If you have your smartphone, you can go to iamscribe.com and then go to our employment page, and you can fill out a contact card. I forgot them. I'm sorry. This was kind of last minute, so. All right. Any other questions? It's a tough crowd. Did I answer everything? How many think they might be interested in doing this? It's a pretty good deal. Normally I get like 70% of the room. losing my touch.
Probably the age of the. I mean, if we're graduating soon.
Graduate, so
You're like, oh, I kind of want to be a nurse, not a medical scribe. Be graduating soon. So, a lot of you guys are going to be graduating. Just mostly.
No, there's varying programs in here.
Okay.
Like I said, most of them are watching online too, so you've got a whole 4 years span.
Yeah. Well, I'm not leaving until I get 10 people. I'm just kidding. Well, we just a quick recap of the facilities that we're in. We're at Mercy Hospital. We're at all the SSM facilities: SSM DePaul, St. Mary's, St. Clair, St. Joseph West, and St.
Clair.
Thank you. We're in BJC, Barnes Jewish. I can never remember those names. It was just recently. It's on our website. You'll see our locations page. If you would like to interview, if you're interested in interviewing for a position, we currently have a couple of openings at our DePaul North team. So a lot of our UMSL students like the DePaul team because it's not too far from here. We have 2 immediate positions open right now. So if you would like to be considered for a position, you can send an email. Write this email down: holly.kennedy, like John F. Kennedy. No relation, right? Mm-hmm. At iamscribe.com. And she'll get you set up for an interview. You'll just need to come down to our office. I'll be conducting the interview because she's new and she has to watch me do interviews. So I'll be here till Friday, so if you'd like to get an interview, I recommend if you can. It's only 30 minutes, so if you can get in before I leave, I'd love to interview anybody who's interested. We can meet. I'll Holly will send you all the steps to complete the application process. The application process takes about 45 minutes. You complete our online application. She can send you all the steps. Then we have a grammar test, which is really easy. And then we have a typing test, which is really hard, and will make you think, what am I getting myself into? But it's harder than, I mean, it's just a lot of it's just the pressure you feel. You'll feel a lot of pressure when you do it, but it's fine. Most people pass. Most technical, people that are comfortable with technology pass. Let me put it that way. And then we have an availability form. Our goal is not for you to crash and burn and drop out of school because you're working so much. Our goal is for you to be successful academically. Like I said, 88% of our scribes move on and grow in a professional medical career. So, I mean, we want to see you grow in that direction. Our goal is not for you to drop out of school and lose everything, right? So we need to check your availability and make sure that you have time to do this job. Our part-time scribes are expected to be available about 18 hours a week. And then our full-time scribes are expected to be available 30 hours a week. And so you'll fill out that availability form and then complete our interview, and then within 2 to 3 business days we'll let you know if you're accepted for a position. If you're accepted for a position and we have an immediate opening, you'll be placed on a team. If not, you'll go on a wait list. Wait list positions usually in St. Louis are anywhere from 30 to 60 days. And we hire about 120 people a year in St. Louis. We have 160 scribes all throughout the St. Louis, is this a metro area? Mm-hmm. Yeah, St. Louis metro area, so. Great. Any last questions?
Thank you for being here.
Thank you so much for letting me come here. Appreciate it.
One last thing before we call it evening, everybody. Just want to recap the requirements for points this semester. So that's 4 hours of either volunteer work or shadowing. You can choose what you want to do. 2 donation drives, 1 presentation, and then attend or watch all the meetings. That's it. All right. Thanks for coming out.
Thank you.
Thanks, guys.
Do you guys know much about the